Hey, everybody, it's Dr. David live from Tampa coming at you to hopefully different aspects of our country, but maybe you're just from Tampa. Who knows? But it's good to see everybody, or at least to be seen. I can't actually see you. Maybe there would be a way to kind of have a format that we could eventually someday see everybody who's there. But, anyways, for those who don't know, I am a board certified pediatrician. My practice is called Holistic Pediatrics and Family Care. My medical cannabis clinic is Holistic Relief. And Dr. David MD is my health education and choice channel on YouTube. So welcome. This is a Ask Dr. David Live. We do a monthly event where we have people offering questions to us, first from our Patreon subscriber list and then from the general population. But also sometimes if there was an interesting question from the past week, I may throw that in as well. If you haven't already, please join and subscribe to this YouTube channel and share it with other people. Let them know that what we're doing. If you like what we're talking about here, probably other people would want to know about it, but they just don't know yet. So anything that we talk about here that I describe is for general education purposes. I will not go into specific details about a given patient, but general concepts that may be coming up for people, etc. So we're going to start off. Whitley is off screen for us, and she's going to be feeding me the questions live, which is always fun to kind of get a question that I haven't seen before. So that's fun. Before I do that, I am going to take a sip of water first. It's as wet as I always remember. Okay, so let's see what we got here. So the first question, is it safe for adults to mix melatonin with cannabis? What about kids? Okay, so first of all, we should understand that we all make melatonin. It's made in the pineal gland of our brain. So anybody technically who is taking any form of medical cannabis, whether it's the CBD, CBG, CBN world, or whether it's THC, you already are mixing cannabis and melatonin. Now, I realize that's not exactly what you're talking about, but I think it's a good point of reference because we know it's something that, for whether you believe we've been here for thousands or hundreds of thousands, millions of years, it's something that as long as people have been using cannabis, they've been mixing it with their melatonin. Now, melatonin in itself is not naturally made and usually only helps somebody with their sleep if they're not making enough in the first place, kind of like insulin. So, but there is no safety problems whatsoever. You're not going to not wake up. You're not going to be so zonked out that you're going to wake up with a hangover in the morning or anything of the sort. Now, I have certainly had many a patient, especially when we start bringing in some of the calming terpenes, when we start bringing in the CBN, that they don't need melatonin anymore, that they find another way of going about it. But if you're just wondering, is it safe to do it? Of course it is. When we talk about melatonin, we also want to be cautious around children because they do have a lot of these gummies and things that look like candies. Obviously, that's true for edibles and gummies for the cannabinoids as well. So, of course, wanting to make sure that kids aren't getting a hold of something. And of course, as I did report on a previous Ask Dr. David video, that with melatonin, you do also have a buyer beware aspect. There are products that don't have anywhere close to the amount or way too much of the amount of melatonin in there. There could be other ingredients as well. So if you're going to be using melatonin, as well as using any form of cannabis, make sure that you're using a clean, accurate, respectable product. All right. Governor DeSantis is claiming that bivalent boosters make people more susceptible to COVID. Is this true? Now, actually, this is something that I read about last night, coincidentally. And the answer is no. Okay. Now, from what I can tell, there is no credible data. And in fact, even in the information that he put forth, that this was actually, and he did quote a couple non-published studies, but actually one of those non-published studies, the authors have actually talked about this, and they said that he is actually misinterpreting the information. Here's what the actual situation is in these studies that he was putting forth. What they're saying is that for some reason, anybody who has had more than 3 COVID vaccines, which means they've had a booster, do seem to be more likely to be able to catch COVID compared to people who don't. Now, is it because people who didn't may have had natural infection a few times already, so they have a stronger immunity? That's certainly possible. But he's talking about what he's referring to is people catching it in the first place. Now, from the very beginning of COVID and our wonderfully designated Operation Warp Speed, which of course many people ask, do we need to be in warp speed when it comes to injecting a biological into a body? That's a whole nother conversation. But the whole point of this and the whole stated goal of the vaccine program was to decrease hospitalization, death, serious problems with COVID. Although, and in my opinion, improperly so, the government and the drug companies, it certainly did seem as if they were implying that we were going to not get sick in the first place, but that's not actually what the mandate was in the first place. Okay, so what they found in these 3 studies was that people more likely to get infected, but they also showed that the people were getting less hospitalizations and less dying from it. So, in my opinion, I actually did a couple of different fact-checking organizations on this too, but nobody believes that what this is an actual accurate statement. That there's some aspect to it in terms of anybody, but what they were showing is that those people who are more getting sick from anyone, it was whether it was the new booster that has the Omicron BA4, BA5, which of course we know our immune systems and the virus have moved past, but for also the original booster. So so they were saying all boosters would do that, and he was saying it was specifically to the Omicron new booster, and that just is not what the facts that have been put forth to us indicate. Okay, so this is a longer question, so I'm going to read it through on here. My 11-year-old daughter was diagnosed with Hashimoto's thyroiditis a little over a year ago. It was an incidental finding when doing lab work for her annual well visit. She is completely asymptomatic of any type of hypothyroid manifestations, except for she does have a goiter, which has decreased in size after treatment with levothyroxine. That's what Synthroid is, T4. And my question revolves around diet. Do you have any advice for eliminating certain inflammatory foods? And do you think that could make a difference? Since she isn't experiencing any symptoms, I wonder if it would be difficult to pinpoint food triggers, or if you believe that there are foods that should be avoided regardless. Okay, so there's a little bit to unpack there, because first of all, I don't typically do routine checking of autoimmune antibodies for thyroid as part of a checkup. Now, is it possible that for this particular family, that there was a history of Hashimoto's already, and so there was a little high alert? And hey, yes, we know that Hashimoto's is more likely to hit females versus males. Do we know that it's more likely to happen once puberty and after happens? So maybe there was a particular at risk for this child that made them do this as part of it, but I wouldn't necessarily call it routine, but it was done here, so that's what it is. Now, one question that I also have is, were these tests repeated? So, if nothing else is going on, it may be worthwhile saying, was it inaccurate? Sometimes there are false positive tests, okay? But if this is real, that means that there is this autoimmune antibody that's directed against the thyroid gland. Now, also because it was mentioned that there was a goiter, and often with Hashimoto's, there's not a goiter, usually iodine deficiency or something else is going on. But if there truly are Hashimoto antibodies, of which there are 2, one's called antithyroid peroxidase, one that's called antithyroglobulin, and if they're there, that is really important, because that means that this individual has an autoimmune potential. And it means that the child is at risk of all other types of autoimmune conditions in their lifetime. The body doesn't just say, oh, I have autoimmune antibodies that I'm going to make against this organ, but I'm not going to make it against anything else. And in fact, as we know that that autoimmunity tends to run down females in the family, I've seen plenty of times where a great grandmother has MS and another the grandmother has Hashimoto's, and then the mother has rheumatoid arthritis on down. So they can be different autoimmune diseases, but they're all autoimmune compromised. So because of that, that's why I would want to be doing whatever I could for this individual to decrease the autoimmune hyperinflammatory potential in the first place. Okay. Now, there's no way that picking out particular foods is going to tell you if there's an issue or not, because there's not a suffering that's going on here. So how are you going to know if it's working? By just eliminating a couple of foods. But taking an anti-inflammatory diet approach, which nowadays, when we talk about the Mediterranean diet, anti-inflammatory diets, if you look at it and understand it, It's what we all should be doing anyways. We shouldn't be having processed sugars. We shouldn't be having processed foods. We shouldn't be having high fructose corn syrups. We shouldn't be putting trans fats into our body. We shouldn't be putting ingredients into our body that we can't pronounce from the label. Okay. Now, if you do an interesting Harvard University rogue organization that it is, right? But if you actually put in Harvard University autoimmune diet, they have a really good, simple introduction and some concepts there to look at. But again, if you go much deeper, there are lots of different diets: the Mediterranean diet, the DASH diet, body ecology diet, the GAPS diet. Those last two are also focusing a lot on optimizing the integrity of our intestines, our microbiome, making sure that the flora are both plentiful, varied, and are given the nutrients to help them thrive. Okay, so taking an anti-inflammatory diet approach would certainly be helpful. Looking at other anti-inflammatory things like higher doses of omega-3 fatty acids, of curcumin. We use a product called Enhansa. Making sure vitamin D and zinc levels are optimized, because we know that those have an anti-inflammatory impact as well. So that's kind of how I would play it. This would be somebody that is at risk, and any effort that can be done to lower their autoimmune, hyperinflammatory potential, it would be a good idea to proceed in that direction. Our 15-year-old son has autism and ADD. He had two seizures last year, both during illness with fever. As a precaution, we have him on 500 milligrams of Keppra twice a day, as well as a half a milligram of guanfacine daily for ADD. That's a non-stimulant medication. It's actually started off as a blood pressure medication, but it does have calming effects, and it can work well, especially if someone doesn't react well to a stimulant medication, or if a family just doesn't want to put them on a stimulant medication. Now, and Keppra is one of the standard anti-seizure medicines. Now, of course, it's not clear 100% to me, was there an abnormal EEG for this person, abnormal electrical activity or not? We know that often that there are times where fevers can cause a seizure, but febrile seizures themselves are not usually presenting in teenagers. These are usually in toddlers where we're starting to see that. And that's just related to the fever itself, and is not a prediction of becoming epileptic. Okay. But in this situation, okay, so first of all, also the question, so maybe I've read this. Do you feel that one of these can be replaced by cannabis, and which type or strain? Okay. So first of all, let's talk about the seizures. Since there was a grand total of 2 seizures last year, if you did put this child on cannabis, how would you ever know that it's stopping a seizure? Because they're not happening frequently enough to be able to document that. Now, yes, if a person said to me, we're having 2 seizures a day, and we put the child on Keppra and it went to 1 a day, could we consider cannabis? And if we see no seizures after that, we know that the cannabis did something. But I just don't know how you could quantify whether it's doing something if he's on the medicine in the first place, and B, if it wasn't that frequent, then we don't know if it'll happen. I have absolutely seen patients through the years just have a couple seizures, and that's it for their life. Now, yes, people with autism, especially in their teen years, are more likely to develop seizures. Just a known thing that we've known forever, more often when puberty kicks in, probably hormonally related. Okay. So that's obviously going to be really difficult to obtain, to ascertain. But let's talk a little bit more about the ADD. Okay. Because that is something that is impacting somebody on a daily basis. And therefore, that is something that we can tell whether it's working or not. Okay. Now, when it comes to cannabis, I've talked before about how there's lots of different cannabinoids, and we all should be minimizing the use of THC in developing brains, which take place up until 22 years of age. Now, that doesn't mean that we don't use cannabis and THC in kids. From what I've been told, I've actually certified more kids for medical cannabis in the state, and like in the top 5 in the country. So we do this a lot. But of course, we always want to weigh the risks versus benefits of doing something. So what I do before I go anywhere into the THC realm is I look to the other non-intoxicating, non-THC cannabinoids. So CBD, of course, the one that we've mostly heard about. Clearly, I've seen CBD products help with this. But there's another one called CBG. Now, CBG is actually the first cannabinoid made by either hemp or by traditional marijuana plants, and it then gets converted to THC or CBD. But CBG, like George, actually has its own wonderful properties on the brain for ADD, for anxiety. And when it comes to strains themselves, and we use a company called Miriam's Hope, which is a hemp-derived over-the-counter products, but it's really a lot also having to do with the terpenes. So if you know about regular marijuana, you hear about there's indigos, there's sativas, there's lots of indigos, there's lots of sativas. And it's the minor cannabinoids and the terpenes that actually are what makes one strain different from another. Okay, there are certain terpenes that are better for pain, better for energy, better for calmness, better for inflammation and pain. So knowing your terpenes, and there's great resources. It's something that we share with our patients in the cannabis clinic. Knowing what the various terpenes are, and then picking strains or products that have those particular terpenes in it would be more helpful than just saying I need an indica or I need a sativa. So knowing that, and one of the nice things with the Miriam products is that you can actually pick different terpene boosts, or you can even select the particular terpenes that you want to individualize the products, which is also really cool that we can do that. But of course, this is the type of thing where you see if the kid's doing better. And if the kid's not, we always take this very low, very slow approach where we start with one product. We only want to make one change at a time. We always say, give yourself 3 to 4 days to assess. Yes, the impact of any cannabinoid will be there within the first time using it, but maybe there was a good or bad day. Maybe you had a test one day, maybe not. Maybe one day was more of a PE field day. So giving a few days to assess would be very helpful, but it's kind of obvious. And what I typically do in those situations is I first try to optimize the cannabinoid in the different ones, but before I tinker with the weaning of the medication itself. Okay, so I hope that helps you some. Are you able to share any insights into a product named NeuroBrock from Sensory Scout? From what I've read about it, I think it could be perhaps prove helpful for my 6-year-old grandson, who is a patient of someone in your office. Okay, so sorry, one more sip of water. A little dry today. Still wet. The main ingredient in and there's a couple different broccoli products I want to mention. NeuroBrock is broccoli and broccoli sprouts. Okay. Now, one of the active ingredients, especially in broccoli sprouts or in the top parts of the broccoli, not in the stalk, is called sulforaphane. Sulforaphane is a sulfur-containing substance, kind of in the realm of what glutathione is, that has really, really powerful anti-inflammatory, antioxidant effects. There's actually been quite a few studies using sulforaphane in autism and helping reduce the autistic symptoms. So that's kind of cool. And of course, when I talk about the spectrum, I refer to a more broad neurodevelopmental behavioral spectrum, of which I do put ADD on that as well. So, it can be very helpful. Some people like to just get broccoli sprouts from the health food store or grow their own, these microgreens, if you will. But in everything in life, of course, we say, what's the risk versus benefit? Now, what's the risk of broccoli? Right? So I have absolutely no problem putting even a young child on broccoli sprouts, or a product such as this. I use a product from Kirkman. That's the broccoli extracts. There's other companies out there as well, but they're all going to be in the same realm. I know there's a couple other ingredients in this particular product, but the main thing is the sulforaphane broccoli. So yeah, I got no problem using it whatsoever, and it can certainly be helpful. So hey, you can give it a try. In your last newsletter, you referenced L-theanine, GABA, CBD, CBN, and magnesium as child-safe sleep supplements. Would you kindly provide specific brands and products that you recommend? I'm asking specifically for my 4-year-old, I'm not going to mention the name, who wakes up every single night and stays awake for hours at a time. For example, he woke up at 1:30 last night and was up probably until 3:30 or so, and then was back up at 5:30. Okay, so this channel is not appropriate to be speaking about particular types of dosings, but in terms of the products that I use. Now, when it comes to L-theanine, sun-theanine in particular is the form of theanine that has been almost all of the studies have been based on. Now, sun-theanine is made by one particular company, and then they are relabeled and packaged by different companies. So as long as it says sun-theanine on it, that will be an acceptable product, and it doesn't matter what the brand is in terms of the ingredient. Now, of course, there could be some issues in terms of other ingredients that are in there, and how well is a company regulating themselves with certificates of analysis, and which, of course, I always say, if it's not on their website, to ask to see the last 3 so you can see how often they're testing and how much and what they're testing for. But certainly that sun-theanine is that. Now, when it comes to the GABA, there's a couple different companies, and the main thing is this: there's several different strengths. So for one, so I may use Kirkman, I may use Metabolic Maintenance. It really kind of depends on the company, but there's a list of brands that I've researched, and in our office, we certainly have that information available, and that's what's in. Those products are also in our web store if you are one of our patients. The CBD, CBN, I'm mostly using a company called Miriam's Hope, but you also have to know about the different terpene blends. You have to know, because you'll see there's different strengths, etc. So of course, those dosing matters in terms of knowing how many milligrams, how to work it up. But Miriam's Hope is the company that I've been trusting the most, pretty much exclusively what I've been doing for sure in tinctures when it comes to over-the-counter hemp-derived cannabinoids. And then magnesium. Now, this really depends on what we're trying to accomplish, because different types of magnesium have different effects. So there are some forms of magnesium, like magnesium citrate and magnesium sulfate, that's Epsom salt, have more of a diarrhea, or a stool softening, I should say, effect that can easily be moved into diarrhea before somebody gets to a therapeutic amount of magnesium in order to have that type of help. Okay, you'll hear about the Natural Calm products. That's something for Vitality. We certainly have used a fair amount of that. But then there are other forms of magnesium that don't have the stool softening to loosening category, like magnesium malate, magnesium threonate, magnesium oxide, magnesium glycinate. Okay, and some of those have different effects, because magnesium malate, the malic acid, actually has some aluminum chelating binding abilities to it. Glycinate is an amino acid that's really good for the brain itself. So it really also, when I'm having the conversation, what the kid's stool is looking like, as well as what other needs might they need, that all goes into depending on which particular magnesium product that I'm going to recommend. Okay. Some nutritionists and holistic pediatricians say that the only probiotics that are of quality are the ones meant to be refrigerated, and probiotics kept at room temperature are worthless. Do you agree or disagree with this statement? Do you have any favorite supplement brands? And are there any supplement brands you try to avoid? Is what I would be getting at an average health food store or shop different in quality? Okay, a lot of great questions there. Okay, so for the most part, what you have heard about needing to refrigerate a probiotic is true. There is an exception, though, which are probiotics that are individually separated into blister packs. So each one is a pack that you have to push through. Those are actually made specifically for travel and do have a longer outside the refrigerator shelf life. But yes, it is felt that about every day that a probiotic is left at room temperature, that it'll lose about 3% potency. Now, that is also depending on how the product is made. So one of my favorite companies that I use is called Kirkman Labs. And what they do is, when they fill their bottles, they, instead of putting oxygen in, they'll put in nitrogen. And therefore there's not an oxidation, and nitrogen is cooler. And so by keeping that, and it's sealed, they put besides the top, there is that layer of protection, like I don't know, foamy kind of like thing that they put over it, plasticky foamy thing. So that keeps it harmonically sealed. And so that will, until it's opened, will actually have a longer staying life than if it was opened. Okay. Now, in terms of, and part of the reason why I like Kirkman is because of their third-party independent testing of every batch. To the best of my knowledge, they were actually the very, very first company to do this. It actually came about because years ago, I had found some of my patients with autism who we were chelating, and all of a sudden, a few of the kids started showing antimony in their urine when we were testing for the heavy metals after chelation, when we were looking for things like lead and mercury. And antimony, that was weird. That was something I wasn't seeing. And I went through all of their supplements lists, and there was one ingredient, one product that was common to all of them, and it was a zinc liquid product. I contacted the company. They tested their zinc. It wasn't in there, but they're like, there's got to be something in there. And it turns out it was in the liquid, the stevia that they were using for the sweetener for the syrup was the problem. And then they further looked and found that almost every stevia product on the market had this antimony heavy metal in it. We took the kids off of the product. When we retested, everything went back to normal. And because of that, Kirkman decided, especially since they were focusing on children with special needs and then know that we need to have purity, they then decided that they would go out and buy a mass spectrometer. So they thanked me for having them spend $1 million on this piece of equipment, so that every single raw ingredient before it even enters their main manufacturing facility is tested to make sure that they're clean. So that's kind of what the backstory is with that. So we talked about brands. So again, what you're getting at the health food store, it varies very widely. Ethan, who is our physician's assistant, just reported to us about 3 patients who he had found low vitamin D levels on. And all 3 of them on their own chose to take the Nature's Bounty chewable gummy. That you'll see that in, no, I'm sorry, Nature Made, excuse me. Didn't mean to, not Nature Bounty, it's Nature Made, which you find in a lot of pharmacies and such. Not a single one of those individuals taking 5,000 of vitamin D budged at all on their vitamin D levels on follow-up. And that should not happen. Okay. Now, this is not a company that publishes their independent and doing regular testing. And Ethan kind of sent a message to all of us, recognizing, of course, he doesn't recommend those products. He recommends what we recommend, but just to kind of reinforce that, not only do you get what you pay for, buyer beware. And of course, there's a reason why we recommend the specific products that we do at Holistic Pediatrics and Family Care, and what I do when I do educational consultations. Wow, these questions are long today. Well, that's good. It makes me think more, and I like the details. Our 4-year-old is having daily poop accidents at school and when playing. She is not bothered by the smell when she has an accident. She is not bothered by the feeling of having poopy in her pants, and will go several hours until someone notices it. She will not tell us the truth when she's asked about it if she has had an accident. She is resistant to using the bathroom when she is asked on a regular schedule. Teachers are having a challenge to keep changing her in school. We've tried to motivate her with rewards and also trying to insist that she tries to go on a regular basis in the bathroom. We are concerned she does not mind having accidents, or worse, will be accustomed to only going when an adult tells her she needs to go. So one of the things that can happen with this type of soiling, fecal soiling, is that there could actually be underlying constipation. Okay. And so if there's a lot of stool in the very end of the rectum, everything kind of gets stretched out. Number one, that could make people lose that urge, that feeling that they have to go in the first place. But there could be like a partial blockage, and then poop can and sometimes even softer poop can go around it. And they may not realize it's happening because it's more of a seepage than it is a bearing down and doing what we need to do in order to how we would normally make a bowel movement. So one of the things that I think is that I will always do in a situation like this is to check an X-ray, an abdominal X-ray, to see if there might be some evidence of backing up, etc. And sometimes we need to do a stool clean out. Now, also, one of the mistakes people make is you can't just do a clean out. The caliber of the rectum, if it's been stretched out. Now, our muscles contract, all of our muscles in this like ratcheting type of motion like this. So in a circle, when the colon contracts, that snake-like peristalsis to move things along, if the colon is too stretched out, there's no crossovers like there would be here to kind of do that kind of thing. So one of the things that people need to do is once they do get a regular bowel pattern going, that they maintain it for 6 to 9 months before they start weaning down, because it will slowly shrink back down to have more contractibility. Okay. Now, that's typically done with stool softeners. I remember at my professor back in medical school saying that when you have something like this, you have to give the anus an offer it can't refuse, which basically means you have to make the stool soft enough that they are going on a regular basis. Now, she may be, but she may not be aware of it. Okay. So you have to get the stool soft enough that she's passing it. And with that, there may be some more accidents, but you may have to take a step backwards before you can take a few steps forward in order to get it closed up. Now, the likelihood that as she gets older, that she's not going to become more socially aware, unless she's a child with special needs. Granted, there are some kids with autism who don't have that social awareness, but most kids are going to kind of be more tuned on. Kids who are 4 to 5 year old, they are while they are mature enough that they can have all kind of conversations, they are pretty clueless when it comes to self or the differences in others, which is also really cool, because so often, younger kids are not even paying attention to who's tall, who's short, maybe the color of their skin, who has exceptional abilities, who has special needs. They kind of are just being who they are. They're just being in existence. So that may be also part of something that's going on, is that she just doesn't have the awareness yet. But that does not make me have any concern, really, that it's not something that is that it's not going to be identifiable and correctable later in life. So, you're doing the right things in terms of, bowel patterning, reward systems. Now, when it comes to reward systems, one of the questions that I do and one of the things that I preach is that making the reward as easy as possible. So I don't know if you're making it that they just get a reward when there's a success. Are you waiting for a week of successes? Are you using a star type of system? So maybe there's a smaller reward for sitting it, a smaller reward for staying there, a smaller reward like a sticker for wiping, but you get a bigger sticker, a bigger reward if you complete the process and have a bowel movement on the toilet. Okay. But that patterning can be really important. And typically once they start to do it, we may say, okay, you're doing so good. Now it may take, a little bit more to get that reward. But part of any good reward, behavioral reward system is you start off making the original award so easy that it's almost like they can't fail, because that gives success. That gives a psyche, a self-esteem. I can do this. Of course, another thing is to make sure that there is no negativity put to that child whatsoever. We don't want to negative reinforce. We don't want to get them in head. That can lead to more stool withholding. Okay, so hopefully those are some tips that can help. Of course, we always can get into those things in a lot more detail in our consultations. Okay, this looks like it's the last question of the day. I have a 19-year-old son about 10 years ago. He was your patient, and you did a treatment of chelation, and we did it for about 3 years. We wanted to know if there was anything new for autism to better his communication skills and to be able to focus. Okay. So, improving communication skills in kids with autism, multifactorial, many different possibilities in terms of things that will help. Um, Wanting to quickly just go back in terms of what you mentioned regarding chelation, not knowing if we had gotten to the point where we had zero metals there. A lot of times, like 6 months, a year later, if we got it all, I like to repeat the test just to see if there's been a reaccumulation. Maybe there's an ongoing exposure. So, of course, yes, it is one of the types of treatments that we have seen bring good communication skills in a lot of kids. Again, that's one of the questions I will ask. Now, again, there are so many other things, that again, I don't know whether it had been tried. Some of them are even old school stuff that I've been using for a long time. Things like DMG, which is dimethylglycine, such as the omega and vitamin combination product from Nourish Life called Speak. I've seen a lot of stuff from that. Methylcobalamin, especially in the injection form, can be very helpful. Now, cannabinoids. I do sometimes have people who will tell me that their kids improve their communication. Now, I wouldn't expect a kid who had absolutely no words ever to start talking with using cannabinoids. But we do know that cannabinoids can help calm anxiety, can open the mind, and can facilitate better communication. Maybe they're hearing words and they know them, but they've just never been able to pronounce them or to utilize them in a functional way. So that's another thing that I would potentially, could potentially consider. I've definitely seen kids start having improved communications after doing sessions of hyperbarics. I actually, one of the very first times that this wasn't a typical thing, where a kid came out of their first hyperbaric session, kind of popped their head up out of the chamber and looked and said, "Hi, Mom, how are you?" Which is something that she hadn't done before, and that was pretty freaky. I was glad to see that I was actually in the room when it happened. Of course, now that we are having much more, again, you said 10 years ago, so I'm guessing that while we may have been checking for MTHFR, I'm guessing also that we didn't go through a more formal, more thorough methylation genetic, nutritional genetic panel like we do through the max function test that looks at like 70 different genes and the single mutations that can happen with the nucleic acids being changed. So certainly that's another thing as well. But certainly, we've learned things throughout the years. And if the last time a biomedical approach was looked at was 10 years ago, there's more than likely something that you haven't done already. All right. Well, thank you so much for listening. Let people know that we're doing this. For people who didn't get a chance to watch it live, we are going to post it afterwards so that people can see it. We do also break down some of these questions into more individual videos for just more of a short type of thing. So be on the lookout for them. But hope you guys have a great month. Continue with these wonderful questions. I love it. We got into some really good details today. And I love doing this. I love helping you learn things. We learn together. So have a great day, everybody. Bye-bye.